Hello guys. Today in this video, I'll examine omega-3 fatty acids' crucial role in lowering high triglycerides. I'll cover types of omega-3, how they work, different preparations available, appropriate dosing and administration, and the evidence-based impact on cardiovascular outcomes. What are triglycerides? Triglycerides are a type of fat in our blood. Chemically, they consist of one glycerol molecule plus 3 fatty acid chains, hence triglyceride. What is high triglyceride or hypertriglyceridemia? Hypertriglyceridemia is a common clinical condition most commonly identified in individuals who have had lipid profile obtained as part of cardiovascular risk assessment. What are complications of hypertriglyceridemia? High triglycerides pose serious health-related complications, including 1. Hypertriglyceridemia causes pancreatitis. 2. Hypertriglyceridemia increases atherosclerotic cardiovascular disease risk like myocardial infarction, angina, and stroke, although it is not a direct established cause of atherosclerotic cardiovascular disease. Therefore, lowering high triglycerides is essential to reduce risk of these complications. A trick to lower high triglycerides your doctor didn't mention. If you're battling high triglycerides, there's one nutrient your doctor might not be talking about enough. It's omega-3, and it could be the natural heart health hero you've been missing. Now let's understand what are omega-3. To fully understand omega-3, it helps to start with the bigger picture. Polyunsaturated fatty acids. Polyunsaturated fatty acids are types of dietary fat found in plant and animal foods. The term polyunsaturated refers to the fact that these fats have more than one double bond in their fatty acid chains. Polyunsaturated fatty acids are considered essential fats because the human body cannot synthesize them, they must be obtained through diet. What are types of polyunsaturated fatty acids? They are mainly divided into two families. First one is omega-3 fatty acids. Second one is omega-6 fatty acids. Now we'll discuss about omega-3 fatty acids. They are a group of essential fatty acids. Essential fatty acid means, 1. Body needs them for many vital functions. 2. Body must get them from our diet. 3. Body cannot produce them on its own. What are the types of omega-3 fatty acids? Let's break it down. There are 3 primary types of omega-3 fatty acids. Number 1. ALA. Alpha-linolenic acid. ALA found in flax seeds, walnuts, chia seeds and canola oil. Consider that ALA must be converted by the body into other types of omega-3 to be used effectively. Second type of omega-3 is EPA. Eicosapentaenoic acid. EPA found in fatty fish like salmon, sardines, mackerel, and fish oil. This type of omega-3 is known for reducing inflammation and supporting the health of the cardiovascular system. Third number of omega-3 fatty acid is DHA. Docosahexaenoic acid. DHA found in fatty fish, fish oil, algae oil extracted from different algae like seaweed, nori, and spirulina. This type of omega-3 is known for supporting brain and eye developing and eye foundation. Before detailing the role of omega-3 in lowering high triglycerides, I will briefly review the management of hypertriglyceridemia in adults. The therapeutic approach to hypertriglyceridemia in adults comprises 2 core strategies, implementing 1, general measures and 2, additional therapy based upon triglyceride level. General measures in the management of high triglycerides are considered a first-line therapeutic approach and should be recommended for all patients with high triglyceride levels. General measures include 1. Addressing modifiable causes. We must address conditions and factors that may cause or exacerbate hypertriglyceridemia. For example, improving glycemic control in diabetic patients, or avoid medications that raise serum triglyceride levels. Non-pharmacological measures are the second component of general measures, which includes three other parts. Number 1. Management of ASCVD risk factors such as management of hypertension, smoking cessation, and addressing a sedentary lifestyle. Other parts of non-pharmacological measures include limiting alcohol consumption, adhering to a healthy diet, and weight management for overweight and obese patients. The last component of general measures is to assess and treat LDL cholesterol according to standard recommendations. An additional therapy for the management of hypertriglyceridemia is beyond general measures. It is based on fasting triglyceride levels and a history of prior pancreatitis. The main components of additional therapy in hypertriglyceridemia are the prescription of fibrate medications and omega-3 fatty acids, which may have some benefits on the risk of cardiovascular diseases. Prescription of omega-3 fatty acids for management of hypertriglyceridemia is based upon subgroup analysis of plasma triglyceride levels. Therefore, I am going to classify triglyceride levels into normal, moderate hypertriglyceridemia, moderate to severe hypertriglyceridemia, severe hypertriglyceridemia. Two therapeutic strategies including general measures and additional therapy for hypertriglyceridemia management have been highlighted. Now we know that when managing hypertriglyceridemia, the decision to prescribe omega-3 fatty acids depends on two parameters: 1. Severity of hypertriglyceridemia. 2. Patient's ASCVD risk factors. Let's discuss the role of omega-3 fatty acids in managing hypertriglyceridemia. Omega-3 fatty acids have a wide range of scientifically supported health benefits. According to the American Heart Association, omega-3 fatty acids, especially EPA and DHA, are the most important types of omega-3, helping to reduce triglycerides, and the research behind them is powerful. Indication of omega-3 fatty acids in managing different severity of hypertriglyceridemia. Moderate hypertriglyceridemia. Triglyceride level in moderate hypertriglyceridemia is 150 to 499 mg per deciliter, and a key goal among patients with moderate hypertriglyceridemia is to reduce the risk of ASCVD events. All patients with moderate hypertriglyceridemia regardless of ASCVD risk level, whether they are at high risk for ASCVD or not, must be instructed to follow general measures as a first-line therapeutic approach. However, for patients with high ASCVD risk whose triglyceride levels remain more than 150 mg per deciliter despite 12 weeks of general measures intervention, the addition of high-dose marine omega-3 fatty acid is recommended. Moderate to severe hypertriglyceridemia. Triglyceride level in moderate to severe hypertriglyceridemia varies from 500 to 999 mg per deciliter. Key goals in the management of moderate to severe hypertriglyceridemia are to reduce the risk of ASCVD events and pancreatitis. Similar to patients with moderate hypertriglyceridemia, general therapeutic measures should be implemented for patients with moderate to severe hypertriglyceridemia, irrespective of their ASCVD risk status. For patients with moderate to severe hypertriglyceridemia who's having a high risk of ASCVD, triglyceride levels are still 500 to 999 mg per deciliter despite 12 weeks of general measures intervention. Marine, omega-3 fatty acids should be added to the treatment regimen. On the other side, for patients without a high risk of ASCVD, after 12 weeks of optimal general measures, fibrate therapy is started after discussing the benefits and risks with patients. If the triglyceride level remains 500 to 999 mg per deciliter despite fibrate therapy, then the addition of marine omega-3 fatty acids is suggested. Severe hypertriglyceridemia. Triglyceride level in severe hypertriglyceridemia is greater than or equal to 1000 mg per deciliter. Management of patients with severe hypertriglyceridemia depends on the presence or absence of familial chylomicronemia syndrome. General measures therapy approach is recommended for all patients with and without familial chylomicronemia syndrome. After general measures approach, drug of choice for the management of hypertriglyceridemia in patients with familial chylomicronemia syndrome is olezarsen with the typical dose of 80 mg subcutaneously once in a month. Very important point is to avoid use of omega-3 fatty acid in patients with familial chylomicronemia syndrome because fat restriction is essential in these individuals. In patients with severe hypertriglyceridemia who's without familial chylomicronemia syndrome, if triglyceride level is above 1000 mg per deciliter, drug therapy is likely to be ineffective for most patients. Defer treatment with fibrates and omega-3 fatty acids until the triglyceride level reaches to less than or equal to 1000 mg per deciliter. Marine-derived omega-3 fatty acid preparations contain omega-3 acid ethyl esters icosapentaenoic acid with or without omega-3 acid ethyl esters docosahexaenoic acid. Factor to be considered while choosing omega-3 fatty acid preparations. Omega-3 fatty acid preparations are selected based on presence and absence of ASCVD risk. Omega-3 fatty acid preparations in patients with high ASCVD risk. Prescription strength icosapent ethyl, which is omega-3 acid ethyl esters of EPA, is recommended. Brand name example of this omega-3 fatty acid preparation is Vascepa. We need to consider these points while prescribing omega-3 fatty acids. 1. Prescription strength omega-3 fatty acid ethyl esters of EPA may worsen the atrial fibrillation. 2. Avoid use of this preparation in patients with paroxysmal atrial fibrillation. Therefore, fibrates therapy is preferred in patients with paroxysmal atrial fibrillation. 2. Omega-3 fatty acid preparations in patients without high ASCVD risk. In patients without high ASCVD risk, any of the available prescription marine omega-3 fatty acid preparations can be used. Treatment options include both. 1. Omega-3 fatty acid ethyl esters of EPA. Brand name example is Vascepa. 2. Omega-3 fatty acid ethyl esters of EPA plus DHA. Brand name example is Loveza. Adult dosing of omega-3 fatty acid. Adult dosing of all preparations of omega-3 fatty acid including ethyl esters of EPA, and ethyl esters of EPA plus DHA is 4 grams once a day or 2 grams twice daily. The icosapent ethyl product, for example Vascepa, is greater than or equal to 96% EPA, so there is 3.8 grams EPA per 4 grams dose. An omega-3 fatty acid ethyl esters of EPA plus DHA, for example Loveza, contains 425 mg EPA and 345 mg DHA per 1000 mg capsule, so there is 3.1 grams EPA plus DHA per 4 grams dose. Omega-3 fatty acid should be taken with a meal containing the healthy dietary fat. Pharmacologic effects of marine omega-3 fatty acids. Effects on lipid levels. Marine omega-3 fatty acids reduce hepatic secretion of triglyceride-rich lipoproteins. Also high-dose marine omega-3 fatty acids reduce serum triglyceride level by approximately 20 to 50%. 2. Omega-3 fatty acid effects on cardiovascular outcomes. Before examining the effects of omega-3 fatty acids on cardiovascular outcomes, it is important to note that triglyceride-lowering therapy reduces the risk of ASCVD. This hypothesis is supported by a meta-analysis involved 197,270 participants in trials examining effects of statins and non-statin therapies including fibrates, niacin, and marine omega-3 fatty acid, on ASCVD outcomes. An evidence-based medicine review of omega-3 fatty acid effects on cardiovascular outcomes. Well-designed studies have evaluated the effect of omega-3 fatty acids on cardiovascular outcomes. These trials are REDUCE-IT trial and JELIS trial. REDUCE-IT trial. In this trial 8,179 patients were evaluated. All patients were on statin therapy and either these patients had established cardiovascular disease plus 2 CV risks or patients had diabetes plus 2 CV risks. 8,179 included patients were divided into 2 groups. FIST group was treated with icosapent ethyl 4 grams per day, and second group was treated with mineral oil. Definition of CV risks in this trial include, age greater than or equal to 50 years. Cigarette smoking. Hypertension. High-density lipoprotein cholesterol less than or equal to 40 mg per deciliter for males or less than or equal to 50 mg per deciliter for females. High-sensitivity C-reactive protein more than 3 mg per liter, creatinine clearance less than 60 ml per minute. Retinopathy. Micro or macroalbuminuria. Ankle brachial index less than 0.9. Authors reported the following results obtained from REDUCE-IT trial. 1. Triglyceride level reduction. Patients treated with 4 grams per day of icosapent ethyl showed a median 18% reduction in triglyceride levels at 1 year. 2. C-reactive protein level reduction. Patients treated with icosapent ethyl, 4 grams per day, experienced a median 13.9% reduction in C-reactive protein levels. 3. ASCVD risk reduction. Over a median follow-up of 4.9 years, icosapent ethyl therapy, 4 grams per day, lowered the risk of the composite endpoint, cardiovascular mortality, non-fatal myocardial infarction, non-fatal stroke, coronary revascularization, or unstable angina. JELIS trial. An open-label JELIS trial, in which 18,645 hypercholesterolemic patients on statin therapy were included. Study patients were divided into 2 groups. Group 1 received icosapent ethyl, 1.8 grams per day, and second group received no additional therapy. The authors concluded that there was a 19% reduction in cardiovascular events in the patient group treated with icosapent ethyl, 1.8 grams per day, an effect largely attributable to a reduction in hospital admissions for unstable angina. Side effects of omega-3 fatty acids. Number 1. Increasing LDL cholesterol. Omega-3 fatty acids may lead to mild elevation of LDL cholesterol. This effect may be seen more with DHA than EPA. Number 2. Risk of pancreatitis. Omega-3 fatty acid may increase risk of pancreatitis. However, there is lack of evidence that omega-3 fatty acid therapy increases risk of acute pancreatitis. Increased fat consumption associated with omega-3 fatty acid therapy might be a possible pathophysiology of this effect. 3. Gastrointestinal symptoms. Omega-3 fatty acids may cause gastrointestinal symptoms including both diarrhea and constipation. 4. Atrial fibrillation. Atrial fibrillation or flutter requiring hospitalization may occur with use of omega-3 fatty acids. The risk of this adverse reaction is higher in patients with a history of atrial fibrillation and flutter. 5. Risk of bleeding. Bleeding including serious events has been reported with use of omega-3 fatty acid. This risk may be increased with concomitant use of anticoagulant or antiplatelet therapy. Thank you for watching the video. If you enjoyed this video, don't forget to smash that like button, it really helps the channel. If you want more videos, please subscribe and hit the bell so you never miss an upload. I'd love to hear from you. Drop a comment below with your thoughts and questions. See you in the next video.